Hi, I'm Dr. Minish Jain for Cancer Talks. A lot of people keep asking me, like, what should be my diet during chemotherapy or radiation? Is there a special thing for cancer patients to take, or are there foods which should be consumed during treatment or after treatment? Now, we all know that our cancer is not only affecting their health, it is also affecting their appetite and diet. So, what are the foods which can be consumed or which are should be added or which should be avoided during chemotherapy? Let's go through it and why they should be choosing this kind of thing. Chemotherapy, as we know, or some forms of even radiation, they cause side effect. Reduce appetite leads to weight loss. They may be vomiting. They may feel nauseated to not even seeing the food. So these are few things which are causing them trouble. Basically, you need to eat a lot of good nutrients and exercise well and consume whatever you have eaten throughout the day. So don't be sedentary during your cancer treatment. Do some exercise and maintain your weight. Why diet is important during cancer treatment? These fluctuations in appetite and body weight, we need to pay attention. As I said, we need to manage them. If you eat a balanced diet during chemotherapy or radiation, it can help you manage the treatment side effect. You can have better energy. You can have uh, better immunity to fight back. You may have less inflammation, and you can also maintain your muscle tone. So these are very important factors which are going to be related to your diet. Now, what are the foods you should consume during your cancer treatment? See, the ideal treatment is you should have a plant-based treatment. That is the first thing you must understand. You should avoid non-vegetarian food to a large extent. Eat foods which are having high in proteins, which are plant proteins. You should eat healthy fats. You should consume whole grains. You should have vitamins and minerals in your diet. And this you should start even before your cancer treatment starts. So you will be in a better position to go through the treatment. How does this plant-based proteins help us? See, when you take plant-based proteins, which may be in beans, legumes, nuts, seeds, you are consuming a high level of vitamins and minerals along with that, and it is easy to digest, which is going to be more nutritious than even uh, going for formed proteins or marketed proteins. The second thing you should consume is healthy fat. Now you can have monosaturated fats, you can have polysaturated fats. Both have benefits. You can use avocado, you can use olive oil, you can use walnut. All these are high in omega fatty 3 acids, which is going to improve your cardiac health, which will help you to fight back your cancer and improve your immunity. So it's going to be a beneficial thing overall. Ghee is also a good fat. So if you are considering compared to hydrogenated oils, consume ghee, which can be much better compared to hydrogenated fats. Now, healthy carb can be like, you can use whole wheat or bran or oats. Now, if you consume whole wheat, you'll be surprised that it is better than fruits and vegetables. It is only less than berries. We generally go for processed grains. Now, that is where the problem starts. So, maida is not good. When you do whole grain, you have 92% more tocotrienols or vitamins, phytins, ligands, which is going to be anti-cancer. So it has got a much better nutrient value. Now you must understand these are soluble fibers which help good gut bacteria. Now how does that happen? So when you consume these soluble fibers, they promote production of short chain fatty acid, which is helping our metabolism, which is helping cellular repairs, which is helping good bacteria in your gut, which is helping your outcome, which is helping you to recover even out of cancer. Consuming vitamins and minerals. Now, this is a big myth. Everybody thinks that I will just consume vitamins and take pills. Don't do that. You can definitely go for some fortified foods like vitamin D fortified food. Milk is there, yogurt is there, there are cereals, there are orange juices. Fine. Vitamin D helps you to help reduce down inflammation. It helps you to improve your immune function. It helps you to have your nuclear transcription factor beta down, which is a cancer forming agent. So definitely vitamin D is good, but vitamin D in our country is available through sun. If you sit in sun for 10 minutes, you have consumed this vitamin adequately for a day. So my suggestion is you can definitely go for fortified foods if you want, but preferably go for a natural source. This vitamin D is helping you to reduce down fatigue. It is helping you to improve your bone strength. It is helping you to improve your immunity. So a lot of benefits out of vitamin D. Don't consume at random multivitamins. Sometimes you are taking chemotherapy which may be hampered by your vitamin consumption. So talk to your oncologist or dietitian, check whether any vitamins or supplements are good for you, and then take it in a right quantity. Now to give you an example, if you consume too much of B12, then your gut bacteria start consuming that B12, and you have more bacteria who prefer to eat B12. So they may not allow the B12 to enter your body. So you must take it in appropriate quantities. So taking vitamins indiscriminately sometimes can be more harming than benefiting you. Now, how do we use this cancer diet to help us? Now, if you take diet during cancer, it can help you to reduce down the problems like appetite loss. You eat small meals frequently, don't go for three large meals. You can have more snacks which are nutrient snacks rather than calorie snacks only. Second problem like constipation can be helped by taking a lot of fluids, water, fiber supplements, adding veggies, adding beans to your meal, which can help you to have bulk and have motions on a regular basis. If you have diarrhea, then you consume drinks which have more in sodium, like you can have sports drink, you can have broths. If you want to take more potassium, then you have bananas, you have natural fruit juices which can be consumed. You can have ORS, and you can have several liquids in this form. If you have loss of taste, then you can go for some uh, flavors like spices. You can have lemon, you can have lime juice. So you can have uh, sometimes coffee, chocolates, they also can improve your taste. So that can be one thing. If you have nausea, then you can have ginger, you can have lemon, you can have peppermint. So all these things can reduce down your nausea. So you can change your diet according to what is needed. And the best thing is, see, your nausea is minimum in morning. So breakfast should be replaced by lunch. So you take lunch at breakfast. Your lunch can be replaced by your dinner, and your dinner should be replaced by your breakfast. So that is how you can make changes, and you can still find that you are maintaining your nutrition, you're not losing weight, and you have enough energy to do your exercise and remain fit. Now, what should be avoided? See, basically avoid processed food during your treatment. You should look at the nutrition labels. So if you are taking too much of refined food, processed food, or if you are taking too much of hydrogenated oils and all, you should reduce them down, because this leads to more of inflammation in your body. How do you plan your treatment? You can plan your treatment through a registered dietitian who can help you to understand what is the calorie, what is the nutrient, what are the things which will help you to make your food more palatable, and those kind of things, and how to maintain your calories throughout the day. What are the things to be avoided by cancer patients? Definitely, raw food and lightly cooked food should be avoided. So, if you are using dairy products, if you are using unwashed fruits, if you are taking vegetables which are unwashed, if you are taking unpasteurized cheese, dairy products, If you are taking anything which is like uh, anything which is not cooked should be avoided, or even anything which is cooked and which has been cooked 2 hours prior should be recooked. So to give you an example, if you are consuming bread, then grill it, so that will recook it. So the bread has been made yesterday and we are consuming it today, so it is raw for us. It should be reheated, recooked, to make it bacteria free, because the immunity is very low during chemotherapy, and that can lead to acute gastroenteritis, which can lead to vomiting and loose motions. So these are certain tips which you can follow during your treatment, which can help you to reduce down your problems, maintain your weight, maintain your energy, and make you fight your cancer better. Thank you.